Hi, my name is Christine Bowen, and I'm a naturopathic doctor. I just want to tell you a little bit about myself today and let you know a little bit about what I do in practice. So, I graduated from Bastyr University, which is local here in Washington, and it's an accredited naturopathic doctorate program. And I got my degree in 2005. So I've been practicing for about 13 years now, and during that time I've become more and more of a digestive health specialist. As you can see, I truly love talking to people about their poop and trying to help them to improve their digestive health through many different types of avenues. Generally, we work a lot on nutrition, but in addition to nutrition, I also will use a lot of different types of therapies, including supplements sometimes, or referrals to people who might do abdominal massage or things like that. So I'm really open to using whatever treatments help my patients heal. I also am friendly with other practitioners who like to collaborate on cases. Originally, I got into naturopathic medicine because I was inspired to try to make a difference in the lives of others. So when I was a child, I had a friend with cerebral palsy, and I used to go to physical therapy with her. And I just loved seeing her play, but knew that it also was a therapy. I also have been inspired by working with communities with developmental disabilities throughout the years, including my little brother, and just wanted to show up and live a life of service. I actually did want to be a doctor for Halloween many of the years when I was quite young, and my mom was always amenable to dressing me up like a doctor again. So I think that my life path was set before me then, and really the thing that inspired me about my own health transformation was that when I was about 7 years old, my mom noticed that I was increasingly sick. I had a lot of asthma and allergy type symptoms, and I couldn't play on the playground with other kids anymore without, spluttering for air and coughing. And I was always kind of chronically ill and just not a healthy kid. And other parents would look at me and say, "What are you feeding your child? Is she actually eating?" Because I was so underweight for my age and my height. My mom took me to a naturopathic doctor whose name is William Mitchell, and he actually was one of the founders of Bastyr University, where I got my degree. This early transformation in my health began with negotiations about what I would eat, what I wouldn't eat as a child. And he took me off of dairy and convinced me to eat fish. And he had me take some natural supplements, and my health transformation was huge. I enjoyed great health for most of my life, and then had some struggles with digestive issues starting in my late teens and early 20s. I'll save those issues in my story about my gut for a future webinar. But today I just wanted to say hello, and this is why I was called to medicine, is that I want to help people, and I feel like I've experienced a lot of what it feels like to be a patient, and I've felt a lot of the frustration that patients feel when they're begging for help and, getting accused of not following the correct diet, or, being treated like it's all in your head. All of those things have happened to me as a patient, and I feel like I'm in a unique position to understand what it feels like to be a patient as well as a provider. And so I hope that my heart and my compassion always come through when I'm working with my patients, and that they also know that I will always advocate for them, and that I will keep on looking and doing detailed testing and really exploring every avenue until their health is returned. I will be a fierce advocate for any patients who arrive on my doorstep. My ideal patient is actually somebody who's motivated to make change in their life. somebody who has tried a lot of things that have failed for them. It's not from lack of trying. They just don't seem to respond the way that everybody expects them to when they're given certain treatments. So my ideal patient is willing to put in the hard work, but then also may have tried a lot of other things that just were not successful, and they're ready for something different. I can really offer something different. I feel like I have a hybrid of experience that really extends beyond what a typical naturopathic doctor, and especially extends beyond what a typical primary care physician is capable of doing. Thank you for stopping by today, and I hope you liked hearing a little bit about who I am and what I do. Stay tuned for more episodes in the near future. Bye!